Dermal fillers versus skin boosters, what's the difference? The third type of skin booster I'm going to talk today is a bit of a bonus one, but it's one that I'm predicting to be the most popular treatment of 2024, so it's worth discussing now, and that's going to be polynucleotides. Now, polynucleotides are a bit different to Profhilo and Redensity 1. This is a branch of regenerative medicine. So with polynucleotides, the chemistry is completely different. This is using salmon or trout DNA to work with your own DNA to cause DNA level change, and basically it targets your fibroblasts, their cells within your skin, to stimulate more collagen and elastin. So it's causing your own skin cells to regenerate. With the other ones I've discussed, Redensity 1 and Profhilo, they both work with hyaluronic acid. So we can think of that as hyaluronic acid being directly delivered into your skin. And that's what's improving the fine lines, hydration, elasticity, and giving the skin a bit of a glow. So that's all really good. With polynucleotides, the chemistry is different. So because it's DNA level change, it's more about stimulating your own skin to produce better quality skin. With your fibroblasts, either you're going to have some that are working a bit slowly, it's going to speed them up. Or you're going to have some that are working perfectly well, it's going to multiply them. Or you're going to have some which are not working well at all, or get rid of them and filter them out. So really, with a polynucleotide, it's about optimizing your skin to function at its best level via an injectable treatment. And the reason why I think it's going to be so popular is there's a group of people who may be more interested in almost your own natural DNA improving itself from internally. So for that type of demographic, polynucleotide's great because conceptually it's a bit less scary than injecting hyaluronic acid into the skin. If you're talking about complications of dermal fillers, the things people worry about, they're everywhere. You can't avoid stuff like this because when you read cases of things like blindness and when you read cases of skin tissue death and all of these things, they exist, which is why it really scares people, and that's going to keep certain people away. Having said that, really that's to do with what's being used, how's it being done, what's the experience of the practitioner, if it goes wrong, are they spotting it and dealing with it, and all of this. So there's a lot more that goes into complication management than just that. And generally speaking with skin boosters, they're extremely safe. But having said that, with polynucleotides, one of the things I love about it is there have been nearly 2 million cases done so far, and out of those 2 million cases, there have been 0 adverse effects. So polynucleotides are extremely safe. So for people who are a little bit more worried about that type of thing, even when you're in safe hands, for those types of people, polynucleotide is going to be a really nice treatment because of its safety profile. The second thing that's great about polynucleotides is because we're not using hyaluronic acid, we can target certain more delicate tissues more aggressively. So we can really target under and around the eyes and even just above the eye and this whole area here. So it's the best option we've got in clinic for improving skin quality under and around the eye. So a lot of people's biggest concern is they feel like they look tired. And historically, the solution to that would be target their mid-face restoration with the dermal filler. So we'll be using something that mimics bone and deep fat to try and restore the bone that's gone and the deep fat that's going, or thinning rather. So we can do that first to give the support. Then, in the right type of patient, do a tear trough filler. So that's along here, and that's going to be to use hyaluronic acid to deliver volume to restore whatever volume has gone within that area. So that's dermal filler. Then we potentially do anti-wrinkle injections around the eye to improve the fine lines and wrinkles on movement. That's going to be using something like toxin type treatment. And then usually for skin, we would have gravitated more towards either medical devices or skincare that you could use at home. Medical devices are going to be generally, we've got some medical devices that are great for under the eye. They're quite aggressive treatment plans and a lot of people don't want to do that. And with skincare, it's a bit tricky because for under eyes, in our whole clinic, we only stock 2 under eye creams. Me, like you, get absolutely bombarded with, oh my god, this is the latest and greatest under eye cream, and what everyone wants is an under eye cream that works for them. Now the ones that we use are by brands called Obagi Medical and ZO Obagi, so these are going to be brands that have a huge evidence base behind them. So they're the only 2 that we stock, and we stock them because they're not the latest trend, it's not a new cream that's kind of, saying it's the best based on absolutely nothing. These are things with a 45-year-long evidence base that we've used in clinic now for nearly 10 years and had great outcomes with. The polynucleotide is an injectable treatment that we can use under the eye, and it's the only one that we would use in the skin for under the eye. Now, when people have got dark circles, pigmentation under the eye, can be helped by improving the skin health and function, by improving the fibroblasts. So one of the main advantages polynucleotides give you is it gives you the ability to aggressively target the areas under the eyes to essentially improve fine lines, elasticity, skin quality, and brighten the under eye. And its safety profile is brilliant. So polynucleotides are extremely safe, which is why people are gravitating more towards them, particularly people who've never had the treatment before, or maybe it's the first treatment they've had, or that they're scared to get dermal fillers. It's like an entry-level treatment into the industry. And for those reasons, I think it's probably going to be the biggest treatment in 2024. And it's not just me who says that, it's lots of people are saying similar things. But I just wanted to tell you a little bit more about it. So to summarise, we discussed polynucleotides, Profhilo and Redensity 1, all as skin boosters. They all do similar types of things because they're all improving your skin tightness, they improve elasticity, hydration, fine lines, they give your skin a bit of a glow. They've all got a different benefit to them. So Profhilo gives a subtle lift, maybe it's a bit better in maybe more sun-damaged skin or slightly more inelastic skin, so it gives a bit of a lift, which is nice. Redensity 1 is maybe a bit better for texture and glow, so Redensity 1's maybe more popular for someone pre-wedding or pre-Christmas even, or pre-big event. And then with polynucleotides, that one differentiates because it's amazing around the eyes in particular. So they're all slightly different skin boosters. So skin boosters target just the skin, hence the name skin boosters. Dermal fillers are below the level of the skin, primarily targeting fat and bone. So with muscle gets tighter in specific areas, usually the frown, forehead and around the eyes. So even if we're treating the deeper layers of the bone and the fat, even if we're treating the skin layers, the elastin, the collagen, the hydration of the skin, even if we're addressing all of these things, the reason why anti-wrinkle injections are the most popular treatment worldwide in the whole aesthetic medical industry is because they've been around for ages, they're super safe as well, and they reliably and predictably do what they're meant to do, which is improve fine lines and wrinkles of the upper face. So these are going to be injections that essentially they'll last for about 3 to 4 months or so. They're going to relax the muscles a little bit. Even with anti-wrinkle injections, there's a spectrum. So one end of the spectrum is going to be what people think a Botox treatment's going to be, and that's going to be, a waxy face, no movement, look very artificial, and can sometimes even look a bit scary depending on how it's done with the eyebrows. And that puts a lot of people off. But then the other end of the spectrum is natural look toxin. So with natural look treatments, these are going to improve fine lines and wrinkles. You can still express, but everything's a bit softer, and that's going to be more kind of anti-aging type of treatment. So anyway, that's a bit of bonus information for you. I'm not going to go too much into that. I hope you found that useful, and if you've got any questions, please do get in contact. We'd always be happy to help you. And if you've got any comments or suggestions, please let us know, and we'll create more videos like this. Thank you.